Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary. Welcome to another episode of Community Matters. Today, I am joined by Althea Martin-Risden, the Director of Health Promotions, Stephanie Antwi, the Black-focused Social Prescription Navigator and Health Promotions at Rexdale Community Health Centre. They're together, which is a community health centre in Toronto, Ontario, and Kisa Hamilton of Transform Practice. In today's episode, we're going to be discussing the Black Social Prescribing report that was recently released by the Alliance for Healthier Communities, with partner community health centers that include Rexdale Community Health Centre, Black Creek Community Health Centre, and Somerset West Community Health Centre, which are our members, and was evaluated in part by Transform Practice. How are the three of you doing today?
Doing well, getting better after a cold, so
yes.
Doing well.
Yes, everyone can enjoy the sultry voices of the ailing in this episode. And I'm thankful that you all had the time to participate, even though some of you might not be feeling the best. And I hope you're all enjoying this beautiful, Toronto weather if we're all located here, because it is a gorgeous state.
Yes, yeah, we've been blessed.
Yes. Awesome. So Althea, we'll start with you. I have had the privilege of chatting with Rexdale in a couple of podcasts and I think some blogs as well. But for anyone who's missed some content, I'd love to hear about Rexdale Community Health Centre, the community that you serve, and the programs that you are offering.
So Rexdale Community Health Centre is located in the northwest end of Toronto, just below Vaughan. If anybody remembers that commercial, the city below Vaughan. So we're right there. And we serve primarily the area covered by Steeles down to Eglinton and from Highway 427 over to the river. So quite a big, a large swath of community with about 20,000 people living in that community. And we're, as a health center, we've been around since 1992 and we've grown exponentially. I started here when we had about 12 people, and now we're closing in on almost 300. So I've loved to see the growth of the organization and all the programs and services that we bring to this end of the city. Similar to other health centers, we offer a range of programs and services. We have our primary care team that provides physicians, nurse practitioners, nurses, foot care, physiotherapy, and we have a diabetic education program as well, as a host of other things that we support under the primary care umbrella. And we partner to extend some of that primary care. We partner with quite a number of services. We have the chiropractic college that sits with us, the naturopathic college that sits with us. We partner with Toronto Dental Health, Toronto Public Health Dental Health Program, and we have a dental health team at each site. And so in addition to that, it's the health promotion team that I manage, and I say that we provide services from cradle to grave. We provide services from for pregnant moms right up to seniors. And everything in between, youth programs, mental health services, client support navigation, Black social prescribing is one of the pieces in the basket. So we provide a range of French language services. Those pieces all sit with the health promotion team. And our third team here at Rexdale is our Pathways to Education team. Many years ago at Regent Park, the ED there identified and started a program to support young people to stay in school. Because for many of our communities, so a similar community to Regent Park here in Rexdale, we have young people who are not, who are failing out of school. At the time when we started Pathways, it was, we were looking at low 50% graduation, and now we're close to 90%. And that program is funded through Pathways Canada, it's a foundation, and they do have funding through the federal government into United Way, but a lot of it is fundraising. And there are three pillars. There is tutoring, mentoring, and supports from a parent student support worker to help them navigate all issues in life. So if something affects a family in the middle of the night, that worker would be there supporting them so that we can have young people graduate. As we know, health is not just seeing, presenting with a health issue. It's health is everything. So whether or not you have food in your fridge, whether or not you're gainfully employed, whether or not you have housing, those are all issues. So education is a big one that we know, and education helps to break down those barriers. Poverty being one of them. And we've just recently been funded for a new interprofessional care team, and we'll be hiring about 23 or so new people. So we continue to grow as we speak.
That's amazing. You're doing so much.
Sometimes I forget how much we do.
Yes, you do a lot. Well, congratulations, especially on the funding. Hiring 23. It's not often I do a podcast when someone says that they're hiring staff, so I'm thrilled. That's exciting. And you did touch on the social prescribing aspect. And so I'm curious, obviously we're going to be talking about the Black Social Prescribing Report, but I am curious what kinds of social prescribing work Rexdale Community Health Center has been involved with.
So I call us an early adopter. So this is the story of us getting involved in social prescribing. A staff member of ours, she is from the UK, and she normally goes home to visit family, and she came back all excited about social prescribing in England. And so we were trying to figure out how to, fund that, get that, in our baskets of service that we provide. And we were one of the sites for the Healthy Kids Community Challenge a few years ago, and that had 5 different themes that we had to implement. One of the first times that we had really healthy funding for our program, it was 3 years, but it was close to $1 million over that 3 year. And so one of the projects that we took on was to implement social prescribing here at the center. So we polled our staff and our volunteers to say, if you're a child, what are some of the things, and if you could go back to your childhood, what are some of the things that you would like? And so we use those answers to support the implementation of social prescribing. The manager at the time worked tirelessly to bring on partners. So she's the one who attracted the ROM. We got tickets through the aquarium. We have partnership with the AGO and certain smaller businesses in our communities. She worked tirelessly to bring them on. And we had the whole organization involved in this. So the physicians, we had pads printed, so the physicians, prescription pads printed, so the physicians could prescribe a social prescribing. And we had a number of staff hired to support them to implement this piece. And so when they would prescribe, we had a staff member who would get a copy of that prescription, reach out to the individual, and then we would fulfill the prescription. We had a basket of services, including some of what I spoke about earlier with the ROM and the aquarium. We had restaurant cards. So, if a family needed a mental health break, and so they could fully go to the aquarium, go out for dinner. We had gym memberships. We had a number of different out of the box things that we were doing with our participants. And we had a pre and a post evaluation. And so when the Alliance, started the process of bringing this on board for member agencies, we informed them of our participation. The ROM at the time had reached out to us to say, they enjoyed the program so much and the process so much that they're going to make this a permanent part of their offerings. and we invited the alliance at the time, and the launch was done here at Rexdale CHC. So the news release that went out to everyone to say the ROM is, fully embracing social prescribing happened right here at the CHC. And so that's how we got involved in the beginning. And of course, that lend itself, and I know you'll be asking, about the Black social prescribing, but that's how we, continue to be a part of this groundbreaking work that we're doing where social prescribing is concerned, because, we saw the value. And thanks to staff who went on vacation, but really wasn't on vacation because she was still had her hat on and brought back, that valued information for us to get going on that.
It's absolutely incredible. I think I find I was saying before, like growing up in New Brunswick, and I grew up on welfare. I find it so interesting because I can imagine how that exposure to culture and that ability to go out and that ability to not feel like you're in a constant fight or flight or survival mode, to be able to go to the art gallery, go to the museum, do, engage with your community. It's so vital. And it's like you were saying before, Althea, your, health is not just going to a doctor. It is the food in your fridge. It is the money that you make, and it is these experiences, which is why I absolutely love social prescribing as a concept. So I'm so interested in it all the time. Stephanie, I will let you tell us about the Black social prescribing work that Rexdale has done specifically, and how they became part of the pilot project.
Okay, I'll start off first, speaking about what Black focused social prescribing is for those who don't know.
Yes.
It's a unique model created to meet the specific health and wellness needs of the ACB community, which is the African community, Caribbean and Black communities in Ontario, through culturally affirming activities. It's not a traditional healthcare. It's social prescribing looks at the person as a whole, and it connects the individual to community-based programs and supports and nurture mental, physical, and spiritual well-being. It's also guided by the 7 principles of Kwanzaa, which centers cultural values, ancestral wisdom, and lived experiences of Black communities. It helps us take back our identity and reconnect with traditions that have always sustained our healing. So Umoja is unity. Kujichawa, I always struggle with that one, is self-determination. Ujima, collective work which is collective work and responsibility. Ujamaa, which is cooperative economics. Nia is purpose. Kumba is creativity. And Imani is faith, which all of these connect the culture, community, and wellness. Together, we honor our ancestors, we celebrate who we are, and we guide us towards collective healing. By embracing these values, BFSP helps Black communities reclaim their roots, strengthen cultural pride, and build healthier and connected futures. So at Rexdale, I myself have had a few programs. We started with a community kitchen, where we worked with asylum seekers who were in the shelters. So what we did was we sent out a registration list where they were able to tell us what they wanted to cook as a taste from back home. We did do the groceries, and we provided transportation as well, picking them up from the shelter, coming to our center, cooking as well, and being able to sit down and have a family with their meals, or friends and family is something they're not able to do in the shelters, and also providing transportation back to the shelter. We've done excursions such as apple picking, blueberry picking, as well as working with other programs here to help individuals learn how to use the food in terms of food waste reduction. So food can stretch, as food insecurity is a big issue in Rexdale as well. To help with the food insecurity issues, we do provide food cards as well as culturally affirming food hampers. We did work with Black Alliance Health as well as African Food Basket to do these for some families every 2 weeks. Yeah, we have every couple of weeks we do some. I run a program called Social Size, which helps also with wellness, as some people may not want to go to the gym and not see that dancing is a form of exercise as well. So it helps with their daily fitness.
Awesome. Thank you so much for sharing. I am curious before we get to the next question, though, was there anything, was there like a specific reason that Rexdale decided to take on Black focused social prescribing as well? Or I guess like for part of this pilot project, is it something that was like rooted in the start? And when you mentioned getting that, like that funding, there was something that was always going to be explored because of the community around you? Or is it like, how did it end up evolving? Because I know not every CHC either like has like large Black catchment area and community, or that's not where they're, maybe investing that money. So I'm curious why.
And so they, not only for Rexdale, but for all the sites that were chosen,
Yeah.
so Rexdale, Black Creek, Taibu, and Somerset, there is that population. We do have a large ACB population, African, Caribbean, and Black. And so it made sense for us to be onboarded. So when we were approached, it was an easy yes for us to participate. We knew it was going to be a pilot project. During COVID, one of the foundations we worked with was the foundation. We floated it to the foundation as Rexdale CHC about social prescribing. And they told us, yeah, we're working on that, over here. And so, to find out that they were working with the Alliance to support that. So we were having that conversation with them, yeah, even before it became official. So I think it had made sense all around for us to be involved, not only because of our population, but our history with social prescribing, as well as the fact that we had a history with the foundation who funded this as well. So, different layers.
Of course, awesome. And so then, yes, the Black Social Prescribing Report is out and it's available on the Alliance's homepage, like website, I believe, under resources. I found it was really easy for me to find, and I will link it in the description of this video so everybody can peruse and see what the amazing work you've all been up to. And I just wanted to discuss, so the Black Social Prescribing Report highlights outcomes, successes, and lessons. So I'm curious if you can share some of the outcomes that are in this report.
So I would say the biggest finding from the report would be that 80% reported food insecurity. And what I would say is, when I'm myself inviting people to certain programs, you hear most of the time like, oh, people need an incentive. So if food is going to be available, they're more intrigued to come to the program because they're hungry. They're not thinking about going to a program to learn about, they want food, right? So I feel like that was the biggest take for me. 80% of people reporting food insecurities. And 68% of participants also were interested in the food programs. So like I said, I did a food as medicine program with Black Health Alliance. And unfortunately, I only allotted 10 slots. So it's kind of difficult to pick just 10 families. And it was different numbers, individual, small, medium, and larger families. That was only for the summer, but it ended, but it was a big impact. And I feel like hopefully in the future it continue. But those are the two things that stood out the most to me.
So in addition to that, some of the information that we've taken from our social prescribing and other programs that we've offered, and with the food insecurity piece in particular, we worked with Food Share a couple of years ago, and we had 90 families that we did a year, and we call it pharmacy with the PH, not the F. And so this was a social prescribing program. Toronto Employment and Social Services picked up on it, and we were able to work with them to fund food cards through Food Share for a number. We partnered with a number of other CHCs in Toronto, and we implemented that. So food is a big part. And so this is not a surprise in this report that we see food insecurity affecting so many of our participants, because it's without a guaranteed income and what we're seeing with rent and all those other things, we know that this is going to be an ongoing issue that we face. So as Stephanie said, you know, how can we engage individuals if they're hungry, if they can't stand up? One of the I was having a conversation with the Premier's office, and the Premier is our MPP here in Rexdale. So I was having a conversation with the Premier's office where I was talking about social prescribing, not specifically Black social prescribing, but about social prescribing. And one of the analogies I gave was to say, you know, we have a client who met with our diabetic education team. They have diabetes. They're given, you know, a list of things to do, but they don't have food. How are they going to manage their diabetes? So it cuts across so many different pieces, and to make it a focal point of our programs, including Black social prescribing, is I think a backbone of a lot of the things that we do. And so seeing, as I said earlier, seeing this as a statistics here doesn't surprise me, but it's the response that we are offering, that we always have to keep that on the front burner of everything that we do.
Thank you so much for sharing, and I hope that our Premier, who is also your MPP, listens to the things that you are saying about the importance and, you know, fund social prescribing more for the whole province. I would love to chat with him and see how many other things we can get going. I appreciate that you were able to have that conversation. Good for you. Kisa, thank you so much for sitting patiently. I'm so excited to hear your perspective in all of this as well. So you work with Transform Practice, who has conducted participatory evaluation, which involved community members as co-leaders and knowledge experts. So I'm curious if you can tell us about the evaluation process for this report.
I'm sure I will definitely share that, but I just want to touch briefly on the food issue.
Yeah.
Mind you, this project, the Black Social Prescribing project, was launched during the pandemic. And so this underlining issue that we have in these particular communities, and let's list them, the Black communities, right, came all surface to the front. So it's not like we didn't know there was food insecurity, access to culturally foods. This is something that is actually being ongoing. But what actually happens in the pandemic, when there's a crisis, that underlining issue always comes to the front in a crisis. The one you tend to ignore, the ones you tend to put on the back burner. And food security was just one of those that was the top of the list. The evidence shows that participants actually turn down other interactive social prescriptions for actually the food prescription, right? And so we need to flag that, and we need to understand the disparities that these communities are navigating. So I just wanted to touch base on that. So back to evaluation. So let's talk evaluation. So I must flag that there were two evaluators. There was the main evaluator, which was logical outcomes. And logical outcome was pretty much there from the beginning of the programming to the ending of the program. And so they were more in charge of the evaluation development. They look at the learnings, they look at the adaptations, look what changes are happening. So they're capturing these developmental pieces within the program. Transform Practice, I would say we are a subcontractor. We came in to do a specific job, and that was participatory evaluation with the program participants, the end users. So our role was that through logical outcomes, and with the Black Focus Social Prescribing team. At that point, when we intersect the team, there was a steering committee, right? There were partners who were doing a lot of work already on the project. There was an evaluation team committee already. So when we intersect the project, there was a lot of players already at work and playing nicely together and have come to some consensus of working and how they're going to take the project together. Let's face it, it was a unique project. It was a pilot project. And there was a lot of clarity around what is Black and what is social prescriptions for Black folks. And so our part of the participatory evaluation was primarily working with the program evaluators, as I said, and with the frontline workers, which were the navigators. So they were the chunk of the team that we work with to co-design the participatory evaluation elements. So the team will meet monthly. I think most of the time at the beginning we met monthly. It was a time of learning. It was a time of bringing participants into an already functioning, working team. And so we have to be mindful of power dynamics, right? Of knowledge, of the comfortableness we have with knowledge at that point when we're introducing participants into a decision-making process. So I guess that's where we as a team, we specialize into centering community voices in the process, navigating power dynamics. And so one of the beautiful thing about the team with the program participants, which we call peer experts, because we're engaging at this point in the project midway where there was already a logic model. So our job is to come in to say, these indicators that are there, that's supposed to say, is this program really working well? We came in to test it, and we have to test it with the ones who are using the service, which is the end users, the program participants. So in a nutshell, that's who we work with. And so part of what we did, working with them, we co-designed the design of the research portion, the community-based research portion. So we picked the tools, the data collection tools, and we collectively do the analysis together. There was a feedback process of input into the process. So it's holding the participants' hands along the way and bringing them to that level really fast, right? And so it was a lot of engagement. So it was a lot of breaking of bread, right? We met, we break bread, we got to know each other. We talk about evaluation. What does it mean? What does it look like? And the tools we actually use, which was the outcome star and a paper quilting process. And it was very interactive data collection tools and very art-based. And so bringing it right down grassrootsy into the program. We would say it was a successful process. And how do we rate success, right? Is when you're working with program participants and they want to know how can they continue to be involved in the program and how can they participate in the learning and the ongoing process. And so that in a nutshell is what we did for the team. And it was rewarding. It was very rewarding for the participants because then they weren't just the end user, they were now part of a decision-making process. They start to learn more about what actually goes on in the background to be able to bring forward a program like this into the community, especially the struggles, right, for having such a program like this at the rate of success that it was operating in and why it was successful. And so to be able to navigate this evaluative process with across the 4 health centers that was part of this this journey, this collective journey of putting Black focused social prescribing on the front, right? And at the top of the Black communities. It was very challenging in some ways, but it was very rewarding. And I think the team as a whole, everyone that was involved from the steering committee to the evaluation team, to the health centers and manager, I was very impressed that the care and the love everyone took, the time spent to make sure that we are doing this right and to be checking in with each other. We know that this was something special, piece of work that we were doing. And I love the fact that the team just wanted to make sure that they were giving it their best efforts and they wanted to make sure that they were doing it right.
That's incredible. I feel like you took on quite the feat, and I feel that it's an impressive amount of work, especially to do that for 4 CHCs. But it also sounds like the most rewarding bit is obviously having people go through all of those stages and want to continue, like you said, to be supportive of the future of the Black social prescribing work and like the report and the work to continue to be done at Rexdale. So kudos. It sounds like quite the project for sure. And I am curious what the main findings or insights were from your portion of, I guess, the evaluation and from the peer experts that emerged from evaluating and doing the report.
So before Kisa go and
Yes.
continue with that, I just wanted to add something to what she said.
Of course.
I think Kisa, it was such a lovely project because the right people were at the table at the right time. So the navigators, they really embraced the program. Yes, the organizations, all four of us, felt that this was really important. But I think it came to life because of the navigators who were at the forefront of implementing this program. This was a part of them. They felt it. And so to do your best for your community, I know that, even just in my mind's eye right now, sitting in meetings and being, when we had opportunity to come together in the same space, you could feel, the feelings in that room were really strong. And so that also lend itself to the success of the program. I think it really we had as staff members implementing. So I would like to, say kudos to them and thanks to them as well. Thanks, Kisa.
I agree. Yeah, with Althea on that. The navigators were the pusher of the program. They were the fighter of the program. They knew their community. They knew how to advocate for the communities. And I believe one of the successes, why the program was so successful, is that the amazing frontline workers, right, that we have, and those were the navigators in the community, and it really showed their passion and their love for the community and how they just, they're always advocating for their team. That's why, even as an evaluator coming in and evaluating, just looking at the different prescriptions, right? The many from hair care to gym care to like the full, was just a whole holistic. And that was basically because, hey, the navigators were women of color, they were Black, and they understand the community, they understand the needs of the community, and they understand the sensitivity, right, of the hardship and the barriers that actually holds people back from connection. And so they were actually the links. They were the link of the community to the health center and of growing that program. And as I said, I don't think the program would have been successful if it was done differently, right? And I'll be bold with that because I'm recalling one of the data collection sessions, and just having the elder women in the focal, and when we were having focused conversation in those communities, having the elders in the room and the young women. And we know in these programs, let's face it, the data shows it's the women that comes out. Men came out, but the percentage was very small, right? So when the prescription is being received, and I think this is what throws the number off. It's the woman who's receiving the prescription, but it's a prescription for the entire family. So the health center might register one person, but that prescription is for an entire family who may not necessarily shop for that consultation with that social worker or navigator, right? So when we're looking at the report and we're seeing numbers, we got to understand the numbers as well and the impacts of those numbers. And so just listening to the story of hair care, how much in the Black community, hair is power. Hair is our beauty, and how sensitive we are with our hair. And just hearing one young girl, what came out of her, the joy to be able to go back out in society because she got a hair prescription to get her hair done. The self-esteem, how it rose, right? And how she was able to go out and to hear these stories, you wouldn't think of it like, why a hair prescription? Like, what's so special? But when you understand the culture and when you understand what hair means to us, and and to hear this young girl share this story, and the elder women, all of a sudden, it's like a community of care open up. And they were like, here's my number. If you want your hair get done and look pretty, just call us up. So here we have the aunties connecting with the young people and just being the elders, right? So it was just navigating these sessions and just seeing the care, the richness in the community, how people actually identify. It is called Black, but I'm going to be bold and put quote unquote Black because nobody connected around Blackness. We all connected around our culture, right? Our diverse culture. We were engaging with the diaspora from the Caribbean and of Africa, and that is diverse, right? And so when a bunch of folks get together, even though we might look the same, we may have the same hue, it doesn't mean that we're all from the same place, right? But it was the connectivity around what brought us together. And so we saw similarities across cultures, around the music, around food, around those prescription that actually brings community together, make them bond and strengthen those bonds. And so, yeah, it was a beautiful project. I was so happy to be part of it. Absolutely blessed to be part of it and to be working across, I know, with amazing people from Rexdale and across from the other community centers that participate and the Alliance. It was just a beautiful team coming together overall to do this amazing work.
You made me want to be in this space. Like, I'm like, I want aunties to give me their number to tell me, because listen, we're always looking for a braider out here. I was like, I feel this passion. Also, if you need a podcast, you need to talk, like you need to be speaking. That was so impassionate. I was like, I need to be in these spaces. It's such important work. So thank you so much for sharing that from the heart. I can tell. Stephanie, I'm curious if there were any specific outcomes that Rexdale experienced, and lessons that your team specifically learned in this project.
So Althea and Kisa have kind of touched on it, where Black-led decision-making, representation really matters. It's found to be the anchor, because if somebody is advocating who doesn't look like you, how much will you really trust that person? So if you're found in a space where someone who looks like you is advocating for you, you're gonna be drawn to that person. You're gonna believe what they're saying, that they're here for you, that they care. So I feel like that's what I learned as well. It creates a safe space. I would say Rexdale, we actually also learned that it's not only food insecurities that's a barrier, it's also transportation. So we do have volunteers that would like to come to programming and workshops, and when we host events as well, but they're unable to come due to transportation issues. So we do also provide Presto passes as well. So they're able to enjoy this prescription that we have, or as well as volunteer.
Thank you so much, Stephanie. Go ahead, Althea.
Yeah, I just wanted to add that, coming up this weekend, we have a bus trip to Apopicin, and it is primarily newcomers, and we're seeing people from West Africa, people from the Caribbean. And for many, this is a new experience. It's about the connection that we're continuing to try to build with the community. So let's come out of the towers and meet your neighbors and, do something fun. We had a young man, he was just so blown away by this Apopicin, the last one we did, that, he followed staff around. The staff was saying, oh, I was so surprised that he hung out with me. I thought he would go hang out with other young people, but he was just so caught up in this event. But what I'm saying to Stephanie and to others who are planning this weekend, we have one bus booked. But if there are more people who want to go, we will find the monies to book a second bus. Because the last time the bus filled up in what, 4 hours? We were where the bus was for, in just reaching out in 4 hours. So if we have that experience again, so that's one of the things about us as well. We pivot, we learn, we are flexible. We try to, not to break down even funding barriers. If the money says one bus, let's figure out where I guess I'm the keeper of all the different budgets. So I'll try to figure out where I could navigate here and navigate there to come up with an additional $200-300 so that we can accommodate everybody in the community. And that's the beauty of some of the work that we do, just us being able to be flexible and nimble and to be able to navigate things that come our way. So just wanted to add that.
Of course, the beauty of CHCs is the wraparound support, and also if y'all will find a dollar, you'll figure it out if you really, really want to, which is what I appreciate. So Althea and Stephanie, for both of you, looking ahead, what are the next steps for the Black social prescribing work that you're doing at Rexdale and like within the Alliance's amazing social prescribing network?
So as you see, Stephanie is still here. We've figured out a way to keep her on board, even though the pilot ended. We didn't want to lose this project. So, we have her for a few more months, and I'm looking into trying to find funding to continue this project. So it is continues to be an important part of the basket of services that we provide. So that's one of the next steps. We continue to work with the Black Health Alliance, because this now is moved to their table, to continue to support this project specifically, and to try to find funding to continue beyond, maybe for us, my year end is March 31st. Others may have funding for other time. I know Somerset West received 1 year funding from their OH. So they were able to hire a navigator, bring back on the navigator for a year. But we would love to, the idea of this was to try and have continual funding and to scale this project up beyond the 4 health centers that participated in the pilot. There are a lot of health centers that are very interested in the Black focus social prescribing. We were just at the social prescribing conference 2 weekends ago, and Stephanie and I led a table to talk about Black focus social prescribing. And we had individuals who sat at our table, left, came back to the table to hear more. And we had, did we have, Stephanie, you can jump in. I think we had 1 or 2 people who stayed the whole 3 rounds. We were supposed to do 3 rounds and they didn't leave. They just stepped to it because they wanted to learn and to find out how they could, implement this at their place. And so we here, Stephanie and I, we're here as connectors as well, teaching others about, the process and, telling our stories. And also, we get requests from across the country, across the world. I've spoken to people in the US, I've spoken to people in Australia, I've spoken to others across, from other countries who've reached out to us as providers of the social prescribing program. So there, we hope to continue to grow the project. The big goal of the Rexdale CHC is to keep that project ongoing, into infinity and beyond. And but also, how can we support others, other sister health centers to adapt to this program and to implement something within the organization. Stephanie, if you have anything to add.
I would say we can also grow by building more partnerships. So that's Black-led groups, healers, community organizations, and more people that can access more people so they can access programs that support their mind, body, and spirit. The Alliance can also focus on sharing what's working, training more providers to deliver culturally safe care, and making sure that the approach reaches more communities. at Rexdale, we can also continue to build on what's already making a difference. And like Althea said, to make this work last forever.
Amazing. I was going to say, I think we need to, one of these MPPs needs to be listening so we can make Stephanie permanent. And so if this certain person is listening, let's set something. Let's get permanent. I would like that for both of you. I forgot to mention that I always plug the websites of the people participating. So I'm going to share where the report lives right now, and then I will ask you all to share websites so that people can learn more about you. But first, at allianceon.org/social prescribing. And then if you go down all the way to the resources part, at the bottom under key resources is the Black Focus Social Prescribing Report. So it is there. I will link it in the description as well. And that link is also on screen now. But that is how to find the report. And Althea, I'll start with you. If anyone wanted to learn more, not only about Black social prescribing, but about Rexdale, the community, the amazing work that you're doing, the plethora of things you've got going on, where would they go?
RexdaleCHC.com.
Amazing. Perfect. And Kisa, if anyone wanted to learn more about transform practice, evaluation, all the things that you're offering as well, where would they go?
They will go to transformpractice.ca, or they can send us an inquiry at info@transformpractice.ca, and we will reply.
Amazing. I love it. Awesome. For the three of you, thank you both so much for taking time out of this lovely day while having scratchy throats to chat with me about Black social prescribing. The work is so important. So I hope that, Rexdale, you're able to continue to do it from here and beyond, as you said. And Kisa, thank you so much for taking the time to share how instrumental you were in the project as well. And I hope all three of you have a wonderful day.
Thank you so much. This was great. This was a lot of fun sharing. And so thank you so much for having us on. I guess it sounds, even with scratchy throats, that we could speak forever. So that just goes to show the passion that we have for this work.
Scratchy throats know no bounds when it comes to Black social prescribing.
Thanks so much for all you do and for putting this on the map for us.
Right. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.